It's actually quite complicated, and I'm hoping you learned some things that maybe you didn't know already in terms of how, your digestive tract, the role of that in terms of hormone balance. So first of all, we'll talk about what is hormone balance, and there are various signs that I'm looking for with for women's health as to what balanced hormones look like. For a woman who's still menstruating, we're looking for periods between 26 and 35 days in length. Having shorter or longer is a sign of an imbalanced hormonal system. Healthy menstrual flow is, dark red, so not too much brown in color. Having a lot of, brown discharge or spotting is considered some degree of hormone imbalance. Liquid without many clots. And average flow, this is always a big question, so I thought I would quantify it. So what a normal period flow looks like, because most people don't talk to each other about what that is. Average flow means about 50 milliliters over the length of your period. Quantified in terms of, pads and tampons, that would be, 3 super tampons over a period, or the equivalent of, 5 pads or 5 regular tampons over a period. So more than that is considered heavy flow, less than that is considered scanty flow, and both of those can be markers of some degree of hormone imbalance as well. Duration of a healthy period would be 3 to 7 days without premenstrual spotting. Having spotting at the end is not necessarily a problem, but in the beginning it can be. Minimal pain, we'll get into that a lot today, and minimal premenstrual changes. Now I'm going to frame that. I think it's normal to have some degree of change in terms of mood, energy, creativity, other things like that, but having really difficult premenstrual phases is something that we would like to work on. Regular ovulation, so noticing changes in mucus or discharge mid-cycle. If you're tracking temperatures, noticing temperature shifts. Also, if doing hormonal testing, noticing a change in progesterone levels is a sign of a good hormone balance there. And then optimal thyroid function goes, affects everything with the menstrual cycle, as well as, energy, mood, metabolism, and things like that. So how do we, test or track hormone balance? Number one is asking lots of questions and examining. Number two, I'm a really big fan of tracking periods on various apps and devices. Most of my patients show me their periods on a device, and I find that enormously helpful to accurately track things and for them to keep notes. I listed a few of my favorites there. If somebody is looking at fertility or more detailed hormone assessment, basal temperature tracking can be quite interesting. You learn a ton in terms of thyroid function, progesterone levels, fertility, whether someone's ovulating clearly by tracking the temperature. And then lab testing, there are 2 main ways to test for hormone balance, and one of them is a saliva panel, and this is most effective for looking at functional levels of hormones, especially putting the stress hormones into the mix. So stress hormones being things like cortisol and DHEA, and they're not very accurately tested on blood work unless you have an adrenal pathology or disease. In terms of functional levels and stress, the best way of looking at that is with the saliva panel. The ones that we offer here are ones that you can either look at your adrenal hormones with your menstrual hormones at one point in the cycle, or there's a 2-point test where we can look at the fluctuation and range of your estrogen and progesterone through the cycle. Blood work is helpful for other things, so it's especially the only way of testing for thyroid function other than doing your basal temperatures as well. Most accurate way of assessing progesterone levels, whether you're ovulating fully and well, looking at LH and FSH ratios, so to pituitary hormone levels, and AMH, which is a marker of ovarian reserve, testosterone and DHEA. Again, it's not the best way of testing for adrenal stress hormones. So before I sort of move on to some of the main points, I wanted to ask all of you, whether there were specific areas with hormone balance that you wanted me to address today in terms of, PMS, irregular periods, perimenopause, menopause changes, so that I can direct some of my presentation to you. Anything that, yes?
PMS among many, many other ones, but I'd say that's the top of my list.
Okay, great. Anyone else?
PCOS.
Okay, great.
What's PCOS?
Polycystic ovarian syndrome.
Thyroid gland.
Thyroid, okay, great. Anyone else? No?
I was going to say PCOS, but also insulin and hormones. Well, I mean,
Insulin and hormones. Okay, great. There's lots on that.
And adrenals.
And adrenals. Okay, all right, we're covered. Good. Yeah. Okay, so during a menstrual cycle, I thought I would give you a little bit of overview of what
You don't mind if I take pictures, right?
No, it's fine. Go ahead. Yeah. During a menstrual cycle, we're looking at the changes in estrogen, progesterone, and testosterone that happens. If I'm measuring a saliva panel with 2 points, what I'm trying to find is, somebody's baseline hormones when things are low at the beginning, so around, day 7 or 8 before the estrogen goes up. And then we also like to measure, try to catch this peak right here so that we find out where the upper range is. And what that tells me is whether somebody has an estrogen overload, whether they have progesterone deficiency, whether they're ovulating, whether their hormones are happening regularly. And then the next one here is an example of what we test for in a salivary hormone panel. So this is a 2-point test. So the first sample here would have been done in that first part of the cycle, and the second part is done on the second part of the cycle after ovulation. And with this patient, she had very bad PMS. That was the main reason that she came to see me. And what we found on this test was that her baseline hormones before ovulation were quite low and actually in a very good range, but her after ovulation hormones were extremely out of balance in terms of high DHEA levels, which is an adrenal hormone that makes you feel more angry and agitated, and quite elevated estrogen levels as well, which could make her feel extremely moody and sensitive, and very low progesterone. So if we look at the range here, it's 65 to 500, and her results were just a 166, which was very out of proportion to the high estrogen. So what this test told me was a lot of information on how to support this woman's hormone balance in managing the PMS. And what we did to support that was we did a lot of work on reducing her estrogen load by supporting estrogen detox, and that's mostly through supplements. In her case, there was also some weight loss that we focused on too. And then we used herbal support to help to bring up the progesterone levels. And again, without testing, I wouldn't know how to support this best. So a big overview of what we're going for today is that the key points to address hormones are that all of your hormonal systems are connected. So some of you mentioned adrenals and insulin and thyroid, and all of those affect the menstrual cycle. They affect the regularity of the periods. They affect fertility for sure. Good nutrition is essential for hormone balance. So your body can't have a normal healthy period or menopause transition or anything like that without healthy, good nutrition. I'm a big proponent of saying that the birth control pill does not balance your hormones, it masks them. There's a lot of misconceptions around that. We'll talk quite a lot about the digestive tract. One of the most effective strategies for fixing period troubles is to treat the gut first. Don't forget about detoxification. So detoxification happens in 2 phases in the body, first through the liver and second through the colon. And if you have a hormone overload, meaning high estrogen levels or high testosterone levels, we need to support both levels of detox so that your body's metabolizing hormones more efficiently. Adding more hormones is rarely the answer. There are exceptions. Sometimes, towards the perimenopause and menopause transition, we may need to top things up to help people to transition through it smoothly, but usually adding more hormones isn't the answer. And right at the end, we're going to talk about embracing the changes that happen through your cycle, because I think that once we start paying attention to changes in mood and energy and creativity and things like that, that sometimes what we frame as negative may not be so bad at different phases. And I like to look at the menstrual cycle as a vital sign, so as a marker of a woman's health. It gives me a ton of information about, you know, her thyroid function, her nutritional status, her iron levels, her stress levels. By watching changes that happen through the cycle, it gives us a lot of valuable information. So now we're going to go through our 10 steps, which the course was, the seminar was advertised as. So step one with hormone balance is to optimize nutrition. Fairly basic things. One of the main nutrients that I'm looking for optimal hormone balance is making sure that women are eating enough protein. I find that often gets skipped. Minimum of 1 gram of protein per kilogram of body weight. Hormone balance requires dietary fat, so going too low fat for any reason is not necessarily a good call for the hormones. I find that that's particularly important for fertility and also really important through the 40s, through the perimenopause transition. Carbohydrate requirements vary from person to person, so with PCOS, even in the thin versions, they tend to be lower. It depends on weight, insulin resistance, presence of PCOS. It's important to minimize sugar and simple carbohydrates regardless. And other things, lots of vegetables, sufficient fruit. Yes?
Where about the second point there about hormone balance requires dietary fat? What about,
Yes.
Postmenopausal?
So,
Menopause.
yeah, so postmenopausal, I find that we can cut down on the level of fat compared to through the 40s and the premenopause time. Premenopause, I find that women often crave and need a lot more saturated fat, like animal fats, so like butter and more oily meats and things like that. They tend to require them, and my theory with that is that the backbone of all of your hormones is cholesterol. So when your hormones are starting to shift and decline, the body often craves more of that to keep things in balance. Postmenopause, once things have regulated again and the estrogen levels have settled into a lower level, I find that the level of fat intake can come back down to, more of a moderate level. I never recommend low fat because low fat often means high carb, high sugar, but not as high as I do when people are trying to get pregnant and also through the 40s. Yeah. So micronutrients are your vitamins and your minerals and your other nutrients, and I picked out some of the key ones that I find are most important for hormone balance overall. B vitamins, so B vitamins are essential for almost every biochemical process in the body, especially vitamin B6, which is most particularly important for PMS. It reduces tissue hypersensitivity to estrogen, and what that means is that if your body has a condition that is estrogen dominant, like fibroids or endometriosis or sometimes polycystic ovarian syndrome, then having sufficient B vitamins helps in terms of that estrogen metabolism. Magnesium is probably one of the most important supplements overall for health for women, and also because we're very low in it. Magnesium is depleted when we go through periods of prolonged stress. And magnesium is required to calm our nervous system down. It improves insulin sensitivity, so it's something that I make sure people have adequate status with insulin resistance and with PCOS. It's important for thyroid production, and it also helps with the production of healthy amounts of estrogen and progesterone. Iodine is a bit of a tricky one. It's absolutely essential for thyroid hormone production, but we also don't want to overdo it. So too much iodine can cause an aggravation of hypothyroidism, so underactive thyroid, and too much iodine can also raise thyroid antibodies, so we need to be cautious with getting the right amount. Yeah?
So sorry. How do you know if you're getting the right amount?
So iodine is something that we can test through a urine sample. It's somewhat accurate. It's a little bit hard to test for that. Usually I go based on symptoms. So if somebody has ovarian cysts, fibrocystic breast disease, fibroids, that type of issue, that's often a sign that there's an iodine deficiency. I usually start low with iodine, and the other key with it is that if you're supplementing iodine, it always has to go with selenium. Selenium will help to protect the thyroid and especially prevent the thyroid antibodies from coming up. There are cases where I will go very high in iodine if I test somebody and they're extremely deficient. I've done that in cases of fibroids and fibrocystic breast disease. That has to be done with a lot of supervision and monitoring the thyroid antibodies to make sure that you're not doing any harm. But it can be quite brilliant in women who have extreme fibrocystic breasts, meaning very painful and large breast cysts that are not improving with age. It can be a great treatment for there, but has to be done cautiously. So sources of iodine are seaweed, fish, and iodized salt. If you're using sea salt as opposed to iodized salt, often we do need to supplement a little bit. Again, I can talk about dosing later. I don't usually like to sort of make generalizations with that. Vitamin D is the other thing. We're almost all deficient in North America, and vitamin D is essential for both hormone and immune system function. I would say that, every woman in North America, unless she goes on a couple of sunny vacations through the winter, should be supplementing, from end of October through till end of April, because we can't absorb vitamin D from the sun during those months because of the latitude in Canada. We're too far from the sun. Oops, wrong button. All right, did I skip a page? No, okay. So I just wanted to talk about one thing around food. I work a lot with food intolerances and testing people for foods that they may have issues with. And endometriosis is a condition that, that comes up a lot here and sometimes diagnosed and sometimes not. Symptoms of endometriosis are having extremely painful periods, and it can often have a very big effect on fertility. There have been, a few recent studies showing that simple things like a gluten-free diet can greatly reduce pelvic pain. So I just thought I'd throw that up there today. It was a study with 156 patients where 75% of them noticed a statistically significant reduction in pain over a year of a gluten-free diet. So food can be extremely powerful at changing our hormone expression. So step 2 is support blood sugar regulation. This is especially important for women with insulin resistance and with polycystic ovarian syndrome. But it can affect, it can affect all of us, because when blood sugar levels are irregular or there's periods of hypoglycemia even, it can aggravate and worsen premenstrual syndrome as well. And too much sugar in the diet tends to make periods not only heavier but more painful too. So some women are more prone to high insulin levels. That can happen partly through genetics. So people are prone to having insulin resistance through family history. That would happen if there's a lot of diabetes in the family. It also can happen due to high dietary intake of simple carbohydrate foods. So sugar, white flour, that type of thing over a prolonged period of time. But other things that cause insulin resistance are smoking, lack of sleep, so sleeping less than 6 hours a night puts all of us in a state of insulin resistance, whether we're eating poorly or not. Magnesium deficiency can aggravate insulin resistance, and as can high stress levels. So when I'm testing for insulin resistance, the most simple way is looking at the ratio of a fasting blood sugar and a fasting insulin level, and we like to see the insulin level quite low fasting. Yes?
So a question about, there's been some reports that high beans, like beans, legumes, fibrous carbs can be supportive of insulin levels, but they're also high in carbs. So what's the balance there?
I would say it depends also on what the rest of the diet looks like. Okay. So on the whole, I find insulin resistance hard to treat in someone who's 100% vegetarian.
Yes.
Because the amount of solid protein is lacking, and every form of protein that they're taking in, unless it's a bunch of soy, which has its own issues, also has more carb with it. So I would say that yes, the beans and legumes and lentils are an excellent source of carbohydrate rather than protein. For somebody who has insulin resistance, but you also want to keep track of the other carbohydrates in the diet as well. Yeah. A typical sign of insulin resistance is carrying weight around the central abdomen, although there are exceptions to that. Insulin resistance is one of the underlying issues associated with polycystic ovarian syndrome, and it is present in most cases, but not all. Also associated with heavy periods and, of course, diabetes. The other note about blood sugar is that being overweight tends to make periods heavier, number one, because of insulin resistance, but also because your body produces a hormone called estrone in the fat cells in your body. And when there's more fat cells, especially central abdomen, it tends to increase your estrogen load, and then that makes the periods heavier. So treatment for insulin resistance, number one is eliminate sugar. Number two is reduce dietary carbohydrates, and that varies from person to person with how low we need to go. For some people, that's just keeping, the carb portion on the plate around half a cup per meal. For some people, that's getting quite extreme. I gauge by somebody's baseline with their fasting insulin level, as well as what their current diet looks like. So, for example, if I have a patient who's already eating fairly low carb, but their insulin is through the roof, we've got to get kind of extreme with that. If I'm looking at somebody who is eating a lot of carbs and sugar through the day, we start moderate. We just start by reducing it and seeing how things improve. Insulin resistance is reversible, and that's the thing to note. It's not diabetes yet. It's something that can shift. And with the correct diet and sometimes additional supplements, it moves quite quickly, usually within a few months. Exercise is important to improve insulin sensitivity. And again, the reminder that sleeping less than 6 hours puts all of us in a state of insulin resistance, whether you're eating a high carb diet or not. And that's one thing that I talk about when I'm working with women after having babies is, the secret to postpartum weight loss is sleep. And it's the most, ironic, contradictory thing you can tell a new mom is that she should be sleeping more, but it is the truth. There are some supplements that help with insulin resistance. Number one is magnesium. So magnesium deficiency alone, can cause insulin resistance, but supplementing with it tends to improve insulin sensitivity. And also remember that magnesium is depleted due to stress, so it is something that we often need to support. Inositol is one of my favorite supplements for insulin resistance, and it is especially helpful with women with PCOS because it improves insulin sensitivity right on the ovaries as well as through the rest of the body. It also lowers androgen levels, so testosterone in women with PCOS. Vitamin D is very important. It's been shown that there's vitamin D receptors right on our ovaries, so it's no wonder that some women tend to have more fertility issues through the winter months. And berberine is a new supplement. So berberine, well, not new, but new in terms of studies for insulin resistance and especially with PCOS. Recent studies have been showing that it is as helpful as metformin, which is a drug used for diabetes in terms of lowering insulin resistance. And I've had some pretty excellent results with that in practice as well. Like anything that people are going to be using on a long-term basis, we have to be cautious with dosing. And usually with this supplement, I do a range of cycling with it, where I have people take it, 5 to 6 days a week with a day off. And maybe 7 out of 8 weeks in a 2-month period, because it is something that is fairly strong. But it's great that we have some natural options there as well. Next step in terms of supporting hormone balance is to lower inflammation. So signs of inflammation would be having painful periods, and joint pains or body aches, fatigue, skin conditions in general are signs of inflammation. Lowering inflammation is important for PCOS, for painful periods, for endometriosis, and for PMS especially. Foods or substances that are inflammatory to the body, it's a pretty short list. Sugar, dairy. Dairy is inflammatory for most of us, especially cow dairy. A lot of people have better tolerance for goat's milk dairy, so if somebody has a lot of inflammatory conditions, my first step will be to transition to goat dairy rather than cow to see if that improves things rather than taking it all out right off the bat. Wheat and gluten, so wheat tends to be inflammatory for most of us. And signs of wheat or gluten intolerance as opposed to celiac would be just regular consistent bloating. Bad fats, so processed vegetable oils, fried foods, deep fried things. Alcohol is an inflammatory food, and then food intolerances, which again is something I test a lot for because testing for food intolerances tells me a person's individual inflammatory foods rather than being very broad in general. So we might find that, for one person, bananas are inflammatory, or eggs are inflammatory, or almonds are inflammatory, things that are, we would consider to be quite healthy foods, but without testing, we don't know. There are a few supplements that help to lower inflammation. Probiotics are a huge one. We'll get into the gut soon. But improving the balance of intestinal flora has a huge effect on lowering inflammation overall. Turmeric. So turmeric reduces inflammation and prostaglandin levels. And it also supports estrogen detox. So very helpful for painful periods and also for fibroids and cysts and things like that. Fish oil, strongly anti-inflammatory. I'm very picky with fish oil supplements. Quality is very important with these. We have pretty significant contamination of our oceans. So there are only certain fish oil brands that I would recommend anymore, and I tend to choose ones that have really good transparency in terms of their testing and purity records.
Question.
Yes.
How much turmeric should a person consume? And I'm not talking using in food for spice, but like if I were to just put turmeric in my yogurt and eat it.
Generally, I start people with a teaspoon a day, and some people will have even 2, but 1 is a pretty good dose. And usually the way I recommend people do it is to make a turmeric milk. So with, either with milk or almond milk or whatever milk alternative you use, blending it with a teaspoon of turmeric, a pinch of pepper, because that improves the absorption, and then either a little bit of honey or half a banana blended in. It's much more palatable that way. Mixing it into your oatmeal or your yogurt would really ruin it. But the turmeric milk, for some reason, is pretty easy to get down. In the winter months, I make a spicy turmeric paste. I can share the recipe with anyone later. But it's like a chai spice flavor with ginger and cardamom and cinnamon and everything in it. And you mix that into hot water and almond milk. It's really delicious.
Coconut milk with that?
Yeah, it's really great. Okay, so next step in terms of hormone balance is gastrointestinal health. And I would say that this is almost at the top of the list. Having a healthy gut is absolutely essential for healthy hormone balance. So remember that hormones are detoxed in 2 steps, number 1 in the liver and number 2 in the colon. Liver function we'll get to soon, but if your digestive tract isn't working optimally, meaning there's constipation, there's diarrhea, there's irritable bowel, or there's an overgrowth of yeast or something like that, then you're not detoxing your hormones effectively or efficiently. And if you're not detoxing well, it's increasing your load of hormone exposure because your body will just recycle it. So if you're very constipated and you've got a high estrogen load, your body's going to increase the load even further because you're not detoxing. Another thing around gastrointestinal health is something called intestinal permeability or leaky gut syndrome. And what that means is that the tight junctions, which are between the cells of the small intestine, become permeable or open, and they allow proteins from the gut to pass into the blood and lymphatic system. What that does is it turns on the immune response. One of the most important things to do for autoimmune disorders, and especially with endometriosis, is to work on repairing the intestinal permeability. Balance of digestive flora impacts inflammation, so that leads into heavy periods and painful periods. And things that you may not know that alter the digestive flora balance are birth control pills or any hormonal contraceptives. So being on a hormonal contraceptive increases the yeast load in the body. It creates a perfect hormonal environment for recurrent yeast infections or also yeast in the digestive tract. So tips to support digestive health are to avoid antibiotics as much as possible. I get that it's not 100% avoidable, but whenever you can. Include sufficient fiber, so aiming for 30 grams per day. Fiber coming from vegetables and fruits, chia seeds, psyllium husks, hemp hearts, ground flax seeds, beans, lentils, that type of thing. Most people think of fiber as coming from whole grains. I would say that's lower on my list rather than higher. A serving of a whole grain food has 1, maybe 2 grams of fiber in it compared to beans or lentils, which have about 7. So there's definitely more efficient ways. People often worry about their fiber if I put them on a lower grain diet. And then supplementing with probiotics is always helpful for a gastrointestinal balance. So some of this I said already, so minimizing sugar is helpful for digestive health, minimizing antibiotic use, Eating fermented foods, for most people, that's a plus. So things like kimchi and sauerkraut or kombucha, so the natural fermented foods, are a way of replenishing our healthy digestive flora. We're one of the few cultures in the world that doesn't naturally have a fermented food as part of our sort of traditional diet. Most countries do, so Korean food has kimchi and Indian food has pickled vegetables, and we don't do that so much here, and I think that that's absolutely essential for maintaining healthy gut flora. Replenishing with probiotics, especially if you've been on antibiotics, making sure that there's lots of fiber, and then rebalancing digestive flora. I'm pretty big on yeast cleanses. Most of my patients know this. And they're used if there are any markers of imbalance in gut flora. That could be from frequent antibiotic use, even if it's long, long ago. So if you had ear infections as a kid, chances are your digestive flora is still not in balance right now. If you've been on hormonal birth control pills for more than a couple of years, if there are recurrent vaginal yeast infections, those are almost always coming from the gut. And if you crave or eat sugar frequently or have irritable bowel, those are signs that your body may need a cleanse to rebalance the digestive flora. So again, one of my sort of rules of thumb when I'm treating somebody with any hormonal issue is to start with the gut. I've had more cases of PMS improve by working on digestive tract than I have by actually trying to manipulate the hormones.
Do you like kefir?
Do I like kefir? Yes, if you're not dairy intolerant. Yeah. So stress. Stress has a pretty big impact on hormonal health, and the reason being is that all of our hormonal systems are connected. So if we start to affect our stress hormones, we're affecting our estrogen, our progesterone, our thyroid function. So the effect of stress on the cycle is that it increases menstrual pain. It raises your prolactin level, which can cause irregular cycles, causes an imbalance in insulin. So when cortisol, one of your stress hormones, is elevated, it tends to make insulin levels and blood sugar regulation much more difficult. And then there's an expression that cortisol steals progesterone. So if somebody's under a prolonged period of high stress, the cortisol will, the precursor to both of those hormones is pregnenolone, so the body will use pregnenolone to make more cortisol, leaving less progesterone. Less progesterone means more PMS, difficulty getting pregnant, and increased estrogen dominance. So estrogen dominance leads to things like cysts and fibroids and heavy periods and things like that. So sorry, it's a little bit fuzzy, but I wanted to talk a bit about these hormones that I just mentioned, about how they're formed in the body. So as I mentioned before, the precursor to hormone in your body is cholesterol, which is why eating an extremely low-fat diet will throw things off with hormone balance. The next hormone on the line is something called pregnenolone, and pregnenolone can go either into the adrenal stress hormone route, so DHEA cortisol, or it can go down into progesterone, and that's where the cortisol steals progesterone comes from, is that the body will produce less progesterone if it needs more, if there's more demand in the stress level. The other thing that I wanted to mention here is that this hormone DHEA is an extremely important one for both fertility, but also for menopause. And the reason being that if a woman is going through menopause and her ovaries are producing less estrogen, she's relying on her adrenal glands and that DHEA level to produce enough estrogen to easily go through menopause through here. So really important to have healthy adrenal function through the perimenopause years and going through menopause, otherwise the transition tends to be a lot more difficult and longer. Any questions? Yes?
Sorry.
It's okay, it's good.
How do you increase your DHEA? I know there are supplements in the
Yes.
market in which I have no interest in, but
Yes.
naturally, through foods, is that possible?
Not really. Through food and rest, yes. So if there was a reduction in stress and lots of rest and plenty of protein foods, the body would repair. It's really a matter of getting your body out of a stressful situation so that it can recover. DHEA levels, we often have a set point that is somewhat genetic. Some people tend to be wired quite high and some people quite low, even when I test them when they're in a healthy hormonal place. In some cases, if somebody doesn't want to supplement with DHEA alone, I will go back a couple of steps and use pregnenolone, which tends to be a lot more gentle, because the body has multiple pathways to use it in. It tends not to to raise the DHEA levels dramatically and cause the negative side effects. General adrenal support like adaptogens, herbal things like ashwagandha and rhodiola and things like that are somewhat helpful for building up the DHEA because they're taking stress off of the rest of the adrenal system and calming down the body. So basically creating a better environment for it to heal.
Are
Yes.
DHEA supplements still banned in Canada?
Yes, yeah. Well, they're available by prescription.
Okay.
Yeah, so technically over the counter they're banned, but in the US you can find them everywhere. That's another topic. Yeah. So in terms of how to manage stress, this would require an individual conversation because it varies from person to person. But some things that I do like, acupuncture is often a fantastic way of helping to balance stress hormones and lower stress because it is a fairly efficient way of getting the nervous system to settle down. Stress management tools can be things from yoga to meditation to mindfulness courses. One thing to remember here is that practicing something that puts your body into a relaxed state or the relaxation response for 20 minutes a day has a pretty profound effect on how you manage stress through the rest of your life. So it doesn't require hours and hours of practice to have a big impact in terms of stress management, but it does have to be consistent. So learning a tool, it could be an active tool like a gentle yoga practice, or it could be a guided meditation can have a big impact on stress hormones. Cortisol levels can be addressed through supplements as well. The most important thing is addressing what the cause of stress was in the first place, but there are supplements that can either raise or lower cortisol depending on what we're looking for. When cortisol is high, we use things like Relora, which is a combination of 2 Chinese herbs, Lactium, which is a dairy extract that works by lowering stress from brain receptors. Phosphorylated serine, holy basil, magnesium are all things that are really helpful for lowering cortisol. Other things that are helpful during stress is we can support progesterone levels and lower prolactin with a herb called Vitex. So if stress is impacting the hormonal system in negative ways and we're not working fast enough to lower the stress itself, there are some detours that can help. So thyroid is next. So having optimal thyroid function is extremely important for overall hormone balance and menstrual cycle health. Signs of low thyroid function would be low basal body temperature. So that would be measured, a thermometer under your tongue first thing in the morning before jumping out of bed. And what I would consider a low temperature would be, a before ovulation or a postmenopause level of, under 36.2. Anything in the 35s is definitely low. A long menstrual cycle is often a sign of an underactive thyroid. Could be other things like polycystic ovarian syndrome, but often a sign. Or if a woman is, 35 and above and still has a 30-day cycle, that could be a sign of a thyroid issue as well, because the cycle length tends to get closer together as we age. Being overweight or difficulty losing weight is a sign of thyroid. Constipation, dry skin, fatigue. Brain fog is an interesting one that often shows up. Swelling in the legs or ankles. And women who are trying to get pregnant, miscarriage can often be thyroid related. And another marker of an underactive thyroid or a borderline one would be finding high prolactin levels on blood work.
If you
Yes.
check your body temperature, let's say every morning for a couple of weeks, and you're always under 36, let's say, can
Yes.
you say safely that you are hypothyroid?
Yes, but in terms of, we'll talk about what form of hypothyroid, yes, it may not be that the thyroid itself is underfunctioning, it might be that you don't have very good utilization of thyroid hormones. But yes, it is pretty safe to say that that would be a sign of an underactive thyroid.
So the definitive would be blood tests though, because then you can see whether or not it's...
Here we go. Yes, so, so in terms of testing for thyroid disorders, I don't like to beat around the bush with this. I like to test it all up front. And the reason being is that just the TSH, which is the basic measure of thyroid function, doesn't give me enough information to know if somebody actually has a thyroid imbalance or not. So TSH is thyroid stimulating hormone, and that's what your brain is telling your thyroid to produce. And it will be elevated in cases of an underactive thyroid because your body's working really hard to produce more thyroid hormone, or it will be really low in cases of overactive thyroid. Free T4 is what the thyroid itself produces. So this is how I tell, is the thyroid functioning optimally? And we want it to be around the middle of the reference range, not too high, not too low. The T3 is telling me how you're utilizing your thyroid hormone. So the body converts T4 to T3 through muscles, through liver, through other parts of the body. And the T3 level is more active or more indicative of how much thyroid hormone is circulating through your body and working with your metabolism. The conversion of T4 to T3 gets affected hugely by stress. That's the most important thing there. Also can be through deficiencies of minerals like selenium and zinc. Anti-TPO and anti-thyroglobulin are thyroid antibodies, and what they are indicators of whether there's an autoimmune thyroid condition going on. So as a naturopath, for me, it's essential to know if somebody has a thyroid disorder, whether it's autoimmune or whether it's stress-related. So you could have an underactive thyroid only due to stress, or more commonly due to an autoimmune process, meaning the immune system is attacking it. And the thyroid antibodies are a good gauge of what's happening there. There's a little bit of controversy around hypothyroid diagnosis and the optimal thyroid range. And the thing that I find interesting is that I work a lot with fertility, and a family doctor will not treat a thyroid issue if the TSH is, in the 3, 4, 5 range, but a fertility clinic will jump on that in a second because they know it's essential for your hormone balance and for fertility. So if it's essential for fertility, why isn't it essential for us feeling well? So I do like to try to get thyroid range into an optimal level. So I'm just focusing on TSH here, but again, looking at the big picture, optimal range for TSH is between 1 and 2.5. Even levels of 3 or 4, if somebody is symptomatic, I'll look at supporting that with supplements to help to bring it back into balance, because symptoms will worsen hormone imbalance, it will increase estrogen dominance, it will make the PMS worse. This one I got a little bit more detailed with. In terms of treatment with thyroid, because there's so many scenarios, the treatment varies tremendously. So if somebody has, a TSH of 10 and, if it's in the context of fertility, I will recommend thyroid medication. If they don't have a lot of symptoms, then I will do my best to manage that naturally, meaning looking at the stress levels, managing cortisol, supporting the nutrients in terms of selenium and zinc, using tyrosine, making sure iodine status is optimal. I have had cases that we can balance things naturally. Sometimes in the fertility race, we can't do it fast enough for somebody to get pregnant. So there are cases where, even as a naturopath, I do recommend medication with thyroid. A TSH of 2.5 to 5 is what they call the subclinical range. This is where the naturopathic treatments I find really excel. I can definitely get people down a couple of points on their TSH with herbal supplements like ashwagandha, with iodine, with tyrosine. If somebody has low T3 with normal TSH and normal T4, what that is meaning is that, again, that they're not utilizing their thyroid hormone optimally. This is usually caused by adrenal stress issues or lack of nutrients for thyroid hormone conversion, like selenium, zinc, and magnesium. So in this case, we address the stress most of all. Elevated thyroid antibodies, what that means is that there's an autoimmune condition going on in the body, so we need to address the inflammation. So in that case, I would look at an anti-inflammatory diet. Avoiding gluten is one of the most important things if somebody has an autoimmune thyroid condition. I find that alone will drop the thyroid antibodies and improve thyroid function. And selenium supplements are the other thing. So it can lower thyroid antibodies by up to 30%, which again is taking more stress off of the thyroid so it can function optimally. Next step is sleep. Positive effects of sleep is that it reduces sugar cravings, normalizes insulin sensitivity, and lowers cortisol levels. Optimal hours of sleep are between 7.5 and 9 hours. Some people do thrive on 6.5 to 7, but I would say that's not the norm. Most people who are sleeping that little are undersleeping. And 6 or less hours a night puts additional stress on the body, so it's another stressor that puts everything out of balance, and it causes insulin resistance. Some thoughts on treating sleep disorders. The first is routine, so having a regular bedtime and wake time. I find that people who stay up really late on weekends and then have to get up really early on weekdays are in a perpetual state of almost jet lag. Taking time to wind down before bed greatly improves sleep quality. So go, work, and then lie down in bed. Even if you do fall asleep right away, it tends not to be as good quality as if you had a little bit of quiet time before. Sort of new on the studies right now is screens, laptops, tablets, and phones before bed. So apparently the blue light in the screens tends to really disrupt our melatonin production. And if melatonin is disrupted, the sleep quality is off. There are some interesting glasses that block blue light. So if you're really set on reading on a tablet before bed, you can get the blue light blocking glasses. I was looking into them. Avoiding stimulating foods at bedtime, so sugar, chocolate, heavy meals. Alcohol, so alcohol tends to knock you out for sleeping immediately, but it doesn't help with the sleep quality, so waking up a few hours later is really common. A lot of women wake up in the premenstrual period or have disturbed sleep before their period. That's not uncommon. That's often a sign of progesterone being low. Progesterone is the calming hormone. Menopausal waking. So postmenopause sleep disturbance is probably the most common symptom. I would say even more common than hot flashes. And it can happen with or without night sweats. There are some strategies in terms of supporting estrogen metabolism that are helpful there. And always working on the adrenal side of that too. Supplements to consider for sleep. I quite like melatonin in low doses, especially helpful in short term because it helps to reset the sleep rhythms. Valerian, 5-HTP, L-theanine, Chinese herbs. There's a lot of things that are helpful for sleep if somebody's not sleeping well. Yes?
I heard a recommendation about eating carbs in the evening to help with sleep. And,
Yeah. I mean, definitely it's a way of helping to reset the hypothalamus pituitary adrenal axis is having high protein for breakfast and having more carbs in the evening tends to help with the cortisol rhythm by getting the cortisol nice and high in the morning and coming down at night. We have to be somewhat cautious with the carbs at night. It really depends on insulin resistance and blood sugar regulation with how much carb at that time. So having like the big pasta dinner is maybe not the answer, but including less carbs earlier in the day and more later in the day is definitely a strategy that's helpful there.
Can something like valerian be addictive if you take it every night and then you become dependent on it?
Valerian can be a little bit habit forming. I find that
They make Valium out of?
no, completely different. But it doesn't last in the system, so it doesn't have a very long half-life. So actually addictive, no, but your body not knowing how to settle down on its own, yes. It could become dependent on it that way.
Would you say for someone who, let's say 10 days to a week before your period, you don't sleep well,
Yeah,
to take melatonin orally or valerian just through those nights?
yeah, definitely. Yeah, during that time, I find that melatonin tends to work the best. Sometimes it needs to be amped up with other things though. But melatonin is one of my favorites for helping to reset the sleep. So if somebody has been traveling a lot or had disrupted sleep because of a stress or a tragedy or a trauma, I find that 2 to 3 months of melatonin supplements nightly helps to restore the sleep rhythm so that they're able to sleep well again. Just the link with melatonin and progesterone as well. So just pulled up a study here, but what this means is that melatonin, which is a hormone produced by the pineal gland in the brain when we're in deep sleep, is essential for progesterone production. So another link on you need enough sleep to have a healthy hormone balance. And that's important in terms of PMS, in terms of fertility, in terms of reducing any estrogen dominant conditions. Exercise. So I didn't put too much on here, but exercise is absolutely essential for hormone balance. It improves insulin sensitivity, so that helps with any of the blood sugar related conditions, lowers stress levels, supports optimal body weight, improves blood flow and circulation, and also reduces menstrual pain. I find a lot of people who have painful periods tend to have a great reduction in their menstrual cramps if they can be active even during the pain. Big caution is not to over-exercise. So overtraining raises stress hormones. And if you're raising stress hormones, you're throwing everything out of whack. So exercise is absolutely essential, but don't overdo it in terms of intensity or frequency. What a too intense workout is varies from person to person though. So it really depends on your fitness, it depends on your overall stress level. So if you're somebody who has a fairly stressful, busy life, and you go to, boot camps or CrossFit classes or things like that, it might actually be doing more harm than good to your hormone balance. If you have a pretty laid back life and you work a basic 9-to-5 job, have a happy family life, and you do some high intensity interval training, it's probably going to be a good thing. So it really varies depending on the level of stress that you have in your life already. And when I'm looking at treating people's adrenal systems and their stress hormones, if their body is really run down or depleted or with high cortisol levels, I make sure that they're not over-exercising. And yeah, it's funny, as a naturopath, I tell more people to slow down their exercise than I do to start, which is strange. Support detox. So estrogen detoxification is really important in terms of managing the levels. So your overall estrogen level depends on 3 things. One is how much estrogen you're producing, and that comes from your ovaries, through your adrenal glands and your fat cells. How well you detoxify hormones, and that is through your liver and your colon. And it also is your exposure to estrogen mimicking chemicals, which are plentiful these days, unfortunately. So we have things that mimic our hormones and bind to estrogen receptors, which increases our load of hormones. Things to support detoxification are to minimize alcohol, lose weight, support the liver, and optimize digestive health. Got some more details on the next slide. There are great supplements to help estrogen detox, and these are especially helpful when people have heavy periods, perimenopause symptoms in terms of more flow, periods closer together, endometriosis, cysts, and fibroids. Some of my favorites are something called DIM and indole 3-carbinol. So they are an extract from the cruciferous vegetables, the broccoli family of vegetables. They help to detoxify estrogen. Another one similarly called calcium D-glucarate. Another broccoli extract called sulforaphane. Turmeric is anti-inflammatory and supports estrogen detox. And the B vitamins, back to the vitamin B6 again, and folate and B12. Just a little quick tip on B vitamins. There is a genetic issue called MTHFR, which is is something that up to 30% of the population carry, which affects how well we detox our hormones. It affects your utilization of folate and B12. It affects mood and neurotransmitters, and it also affects how you age with your glutathione production. It's pretty significant in that women who have this enzyme issue tend to have a lot more hormonal issues, meaning they have more PMS symptoms. They're more prone to, to endometriosis or ovarian cysts or even breast cancer because they don't detox their hormones very well. So it is something that I quite frequently test for when I'm working with somebody who is doing a lot of things right, meaning they're eating well, they're exercising regularly, we're supporting detox, and they still have a lot of symptoms, as I'll look at the genetics so I can get a little bit more clues in terms of how to support it. Because it's a fairly simple thing to support nutritionally, because these people with MTHFR defect just need more B vitamins, and more than we would physiologically think are necessary. So, quite a lot of B12 and folate are required for those scenarios. The last step I want to talk about is removing estrogen mimicking chemicals. So endocrine disruptors, what they are chemicals that alter your hormonal function. So they may block estrogen detoxification, or they may mimic estrogen, meaning they bind right to an estrogen receptor, or they may affect your thyroid function. And unfortunately, we're living in a bit of a chemical soup right now, so there's a lot of these things around. Some examples are bisphenol A, so BPA. I've got more info about these on the next page. Phthalates, which are in plastics. Fire retardants, which are in less clothing now, but they're still found, and in a lot of furniture, like couch covers and things like that. And pesticides and insecticides. So steps to minimize exposure. Number one is minimize plastic use. Even ones that say BPA free, I still don't trust. There's so many chemicals that we haven't named yet that I don't think it's optimal to use plastic for most things. Using glass and stainless steel for food storage and for water bottles. Big one is never heat food in plastic in a microwave. Choosing organics, really helpful to lower your chemical load. I like to use the environmental group's Dirty Dozen list as a guideline of which ones to prioritize, and the list does change year to year. I don't believe that the kale was there, and I don't think cucumbers were as high last year, so it does seem to shift. So these are the ones to prioritize buying organic. Generally fruits and veggies with a thicker skin have less pesticides on them, but then there's a few surprises too. So that's that list. So that includes apples, celery, cherry tomatoes, cucumbers, grapes, nectarines, peaches, potatoes, snap peas, spinach, strawberries, sweet peppers, hot peppers, kale, and collard greens. And great list to know right as we're hitting the summer produce season of which ones to get from the farmers, the organic farmers markets. So this is a list of the most significant hormone disrupting chemicals and where you would find them. Phthalates, so they are found in plastics. They are interestingly added to a lot of cosmetic products, which seems a little bit crazy, but they're in a lot of shampoos, conditioners, lotions, and perfumes. They're definitely in vinyl products like vinyl shower curtains, even some pretty innocuous looking rubber duckies and things that we put in our baths. Products with fragrance added to them, plastic food containers. So it is something to be wary of. Bisphenol A, so BPA is found in hard plastics, polycarbonate water bottles, so like the water jugs that most people have with the water coolers, plastic lining of canned foods and jar lids, and a lot of hard plastic toys. Perfluorinated chemicals, which are found in nail polishes, some moisturizers and eye makeups even, shaving creams, dental floss, Teflon, nonstick cookware, and Gore-Tex clothing. So I guess if you're not ingesting Gore-Tex, it's probably fine as an outer layer. Triclosan is in antibacterial products, and this one's pretty significant because it has very big hormone disrupting effect, and it's been shown to be cancer causing as well. So that's all the antibacterial soaps and acne treatments and body washes and things like that. It's really everywhere. I'm not a fan of antibacterial anything. And then parabens are the most widely used preservative in cosmetics, and they're a big estrogen mimicker, so they bind to the estrogen receptors in the body. So they are found in most non-organic shampoo, conditioners, sunscreens, deodorants, toothpastes. So one thing that I wanted to sort of end with here is looking at embracing our cycles rather than fighting against them, which I found to be really helpful myself in terms of tracking things. So this is an extract from a book called Woman Code by Alyssa Vitti, where she talks about the different phases of the cycle and what tends to be the positive side of it. And what you might find if you start tracking your cycle is that there's a certain time of the month where you have lower energy, but maybe you're more introspective and a bit more of a dreamer, and you're good at planning or things like that. You might find that there's another phase where you're really productive or that you're more creative. So this is generally an overview. You might find that it varies a little bit for you. I find that mine didn't quite match with this, but that might be my age. Maybe this is how it was in my 20s. First phase of the cycle is when you're menstruating, and of course energy might be lower, but some of the positives there is that the communication between the right and left hemispheres is more powerful during that time. So you may be more prone to life evaluation. So maybe the being more quiet and internal is a plus at that time. And maybe that's also a time where you try to tone down things in your life so that you have a bit more time to be introspective, that there's less demands. The follicular phase is from the end of menstruation to ovulation, and that's generally where people's energy tends to improve. The next phase is the ovulatory phase, and mid-cycle tends to be where your communication skills are heightened. So that's where you're able to communicate your thoughts and your opinions more effectively and more clearly, and you might feel more connected with people. Of course, the ovulatory phase, if you're trying to get pregnant, you probably feel better libido and more interested as well. Luteal phase, so that's after ovulation, and that's before your period starts. So gradually the energy tends to decline. I think this is a time where we all need to pay attention more to self-care because our moods tend to go as well. The neurotransmitters are affected during that time. And more attention to self-care and downtime, slowing down the social events and the commitments during then as well. Great, so that's the end of my presentation today. Were there any questions that anybody had from today? Anything else? Yes?
With the thyroid levels.
Yes.
Let's say you get them tested by a doctor, your blood work.
Yes.
Can they vary from one day to the next week to the following week? Like, let's say one day where you got your blood work done, your cortisol levels were not super
Mhm.
high, but the next day when you're not getting your blood work done,
Yes.
your cortisol levels are super high. Because I have had my thyroid checked, and even though every symptom of hypothyroidism screams me,
Yes.
my tests have come back normal.
Right. It can fluctuate. Yes. It even fluctuates during the day.
So what's the point of doing blood work then?
It shouldn't fluctuate too much though. Like it shouldn't be fluctuating like 3 or 4 points. It might fluctuate by like 1.5. And it's still a ballpark. Yes, we have to go by symptoms as well though, because there's also how you're utilizing the thyroid hormone, and your body might be slowing down the thyroid function for a reason, meaning it won't show on blood work. So for example, if you've been overdoing it and you're overstressed, your TSH might look normal, but your T4 and T3 are low because your body is, trying to slow you down to make you rest more.
There were 10 tips. Would you prioritize them in the order that you presented them in? Or
Not necessarily.
Or would you say, like, first get sleep, second get working your gut?
I would say it's individual.
Okay.
So the order varies from person to person. I put them in that order because that logically made sense to me at the time.
Yeah.
But usually when I'm working with somebody, I'll pick 1 or 2 to start with. And that's what I would recommend to all of you as well, is to pick 1 or 2, of those steps to focus on for now, rather than trying to take on all 10, because that's way too overwhelming. But there's probably a couple of them that spoke to you that actually are more applicable than the rest.
So then put yourself in adrenal fatigue and make it worse?
What's that?
If you try to do all 10 at once,
Of course,
you put
yes.
yourself in adrenal fatigue and make it worse.
Yeah, yes, exactly. And then everything gets bigger, yes. Yeah. Anything else?
A very basic question. PCOS,
Sure.
can it be treated or it needs to be managed?
It depends how it formed. So if it has always been there, then it is a matter of managing it. But there are different forms of PCOS. So some people develop it after coming off birth control pills. In that case, it can be reversed and treated. Sometimes it's inflammatory in nature, meaning there's inflammatory causes to the hormone imbalance rather than insulin resistance, and in that case it can be treated. If it's a very traditional, there's insulin resistance behind it, there's diabetes in the family, then in those cases, yes, I would say it's being managed. But once you get some of the underlying factors in check, it requires less management over time. Yeah, is that clear?
How do you know if it was birth control related or it's always been there? Like, how do you figure it out? Because sometimes you find out.
Well, so things I would be looking for would be, were there irregular periods as a teen? So, or was there bad acne as a teen? Were there some of the symptoms that would, that could be diagnosed as PCOS very early on? That's not necessarily all of it though, because sometimes, the period is just slow to start and then a woman went on the pill too young.
Yeah.
The pill-related PCOS is an interesting one, and I do see it a lot, where the hormones look exactly like PCOS, and there's cysts on the ovaries, and there's no periods for up to a year after coming off the pill. And if there isn't the rest of the history, the periods were normal before going on the pill, that is reversible. I get a lot of women with that scenario coming in, yeah. And the inflammatory one, usually we find that there isn't any insulin resistance. So that's the difference, is we have high androgens, we have the imbalance in the hormones, we have cysts on the ovaries, but there's no insulin resistance. In those cases, I'm looking for other causes. Yeah. Great. Good?
I promise one.
This is great. I like it. I like interactive.
2 years ago, I had a myomectomy and an ablation.
Yes.
You know,
Yes,
of course
yeah.
you do. Does that mean I had PCOS?
No.
What did I have?
So myomectomy means you had a fibroid.
Okay.
Yeah, and an ablation was to thin the lining.
Right.
Yeah, to stop heavy flow.
But I didn't have endometriosis or PCOS.
Endometriosis, I have no idea, because that could be on the outside of the uterus, around the ovaries. It doesn't necessarily show up on an ultrasound or during a procedure. PCOS, again, I don't know what your ovaries were doing, but it's unlikely. Yeah.